Okay, for this session, we're going to be looking over and observing the patient's neck. So for beginning of this, we're just going to want to look at the neck, just kind of like with the face, where we're going to look for any skin lesions, masses, edema, hyperpigmentation, any asymptomatic issues, which I do not see any. We're also going to observe the thyroid gland and the trachea to see if there's any tracheal deviation or thyroid deviation. Once we have done that, we're going to then take a pen light. This will allow us to see any shadows that we might see not be able to see by just checking out with normal lighting. So for this, I'm just going to look obliquely onto the thyroid gland. See any shadows on her left side? I do not see any shadows on her right side. So for this, I'm also going to stand behind you, but for right now, I'm just going to palpate your tracheal deviation just to make sure it's normal, if that's all right with you. Okay, so I'm just feeling right there, palpating just to make sure it's normal, and it is. Okay. I'm then going to stand behind the patient and palpate her thyroid gland just to feel for any abnormality, hardness, or anything out of the ordinary. So for this, I'll probably go one hand at a time just to not give off a strangulation type feeling. So for this, just feels normal and also feels normal. Last thing I'm going to do for observation of her neck is that I'm just going to have her tilt her head back and swallow and observe her thyroid gland and her tracheal movement as she does this, which looks normal, that has the normal rising with swallowing. Next thing I'm going to do is look at her lymph nodes. For this, I'm just going to evaluate different lymph nodes across your head and your neck. The first lymph node that I would start with is probably the preauricular lymph node, which is in front of the ear. I would then feel for the post-auricular lymph node directly behind the ear. I would then feel the tonsillar lymph node forward on the jaw to the submandibular lymph node. Then all the way almost to the chin, feel for the submental lymph node. I'll then come back to her neck and look at her in the area of her SCM. This is where you can palpate for the superficial cervical chain lymph node. And then just behind the superficial cervical chain, a little lower, would be the posterior cervical chain. Okay, and then we go back to the SCM. Try to push out of the way to feel for the deep cervical chain, which is a little difficult to do. The last lymph node that I would check would be her supraclavicular. So for that, I'm just gonna feel your just under your clavicle, and for that, I'm gonna feel on both the right side and the left side. So for all of her lymph nodes, I felt nothing abnormal. There was no enlargement or any fixation that would cause for concern. It all felt pretty normal. So for the next thing I'm going to do is I'm going to do a little bit of auscultation with their internal carotid artery, just to listen for any bruit or swishing noise. Okay. For this, I'm just going to go towards the base of the SCM and go slightly over with the bell. Don't feel any abnormality or hear any abnormality, and then repeat on the opposite side. Also not feeling or hearing any abnormality. Last thing I'm going to do is test your cranial nerve, specifically cranial nerve 11, so the accessory. For this, I'm just going to have her first resist my pushing down her shoulders, so just do kind of like a trap workout. Perfect. And I would rate that as a 5. The next thing I would do is assess her SCM. For this, I would have her push against my hand. Good. And then you can see clear her SCM, clear line, looks good. Then I would have her do the opposite side and push, also revealing a good SCM. I'd also ask her if she had any pain or anything with that. Was there any pain with either of those two?
Nope.
Indicating that she has a good muscle strength, so I would rate her a 5 out of 5.